The Executive Board, considering the provisions of Article 52 of the Constitution of WHO, considering the nomination made by the Regional Committee for the Western Pacific at its 69th session, first appoints Dr. Takeshi Kasai as Regional Director for the Western Pacific as from 1st of February 2019. Second, authorizes the Director General to issue a contract to Dr. Takeshi Kasai for a period of 5 years from 1st of February 2019, subject to the provisions of the staff regulations and staff rules. Thank you.
I shall now invite Dr. Takeshi Kasai to stand up and take the oath of office.
Yes, please.
I solemnly swear to exercise in all loyalty, discretion, and conscience the functions entrusted to me as an international civil servant of the World Health Organization, to discharge those functions and regulate my conduct with the interest of the World Health Organizations only in view, and not to seek or accept instructions in regard to the performance of my duties from any government or other authority external to the organizations.
Thank you. Congratulations.
Thank you very much.
Thank you.
May I invite you, Dr. Takeshi Kasai, to say a few words? Or sign first?
Yeah.
Yeah.
Good. Now you can invite him to say a few words.
Okay, now if you would like to say.
Thank you, Madam Chair. I thank members of the Executive Board for the trust you have placed in me to lead the WHO's work in the Western Pacific regions for the coming 5 years. It's a great honor to be nominated as the 7th Regional Director of the regions. The outgoing Regional Director, Shin Young-soo, leaves very big shoes to fill. Under his leadership over the past decade, we have transformed WHO in the regions, truly country-centered, and supported member states to achieve significantly improve their health status. I'll do my best to continue Dr. Shin's legacy and to build on it, but go further. We cannot stand still because our regions are extremely dynamic and it's rapidly changing economically, socially, and environmentally. If we wanted to stay relevant and then valuable, we must be also ahead of the curve. Some of the challenges we face are great, but they are not insurmountable. Innovations and new technologies make things possible that we could not even think about decades ago. And by acting today to address the challenges of tomorrow, we can turn challenges into shared opportunities. Madam Chair, in the time of rapid change, I think it's important to go back to the fundamentals. Over the New Year holiday break, I had a chance to visit a remote town of northeast coast of Japan, where I started my career, public health career 30 years ago. I visited one of many mentors I have so fortunate to have over the years. She is now 90 years old and still healthy. She is a doctor who devoted her 50 years career to public health in the community. Visiting her reaffirmed for me the importance of the community and the power of the primary health care. At the end of our visit, she told me, "My career was full of challenges, but it gave meaning to my life." As I make this speech today, thousands of health workers are hard to work in our region, providing health services to their community. And as a regional director, I'll do my best to strengthen primary health care in the region. And doing so, I'll try to ensure that healthcare workers have the same kind of fulfilling career as my mentor had. Madam Chair, the Western Pacific region is both vast and diverse. Every country is so different, and we need a tailored approach if WHO is to be truly people and country-centered. At the same time, there are shared ambitions and common agenda which unite all member states. WHO must support both country and regional health aspirations through close dialogue and very good understanding of the realities on the ground. And this is why regional offices have such an important role to play in our organizations, and why it is such a privilege to be nominated to this role. Finally, Madam Chair, let me say that I very much look forward to working closely with the Director Generals and the other regional directors to deliver the GPW13 and its vision of health as a driver of the global development. I'll take up the role of the Regional Director of the Western Pacific with great humility, but I'm also confident and optimistic about the future, because our region is home to so many dedicated staff, committed member states, and capable partners. As a new regional director, I would like to work with all those people in the coming 5 years to make our region even more safer and healthier region. So thank you very much.
Thank you, Dr. Takeshi Kasai, for your wise words. I shall now give the floor for the Director General, Dr. Tedros. The floor is yours.
Thank you. Thank you, dear brother Takeshi. First of all, my warm congratulations on your election and appointment as Regional Director. This honor is richly deserved. In October, the member states of the Western Pacific voted decisively to entrust you with the formidable task of succeeding Dr. Shin Young-soo. And today, the same again, unanimous support from the board. As you said, you have big shoes to fill, but I'm confident that you will fill them very ably as you follow in his footsteps of putting countries at the center of everything you do. You have served WHO with distinction for more than 15 years, both in the regional office and as country representative in Vietnam. Your experience as a physician, as a country representative WR, in health emergencies, and as Director of Program Management make you a perfect match for this role. I believe you have what it takes. The priorities on which you campaigned align perfectly with those of the general program of work or our strategic plan: health security, climate change, non-communicable diseases, and aging. As you rightly said, people-centered primary care is a platform for progress on each of these priorities. And primary health care is the center of gravity of universal health coverage. From the steppes of Mongolia to the beaches of the Pacific Islands, from mega cities to remote villages, the Western Pacific is a region of incredible contrasts, unique challenges, and unlimited potential. And I fully agree with you with the tailored approach that you have just proposed. The health of its people is integral to the economic, social, environmental welfare of our world. I look forward to working with you closely to create a healthier, safer, fairer future for the people who call the Western Pacific home. You have my full support, my full confidence, and my best wishes. Congratulations. Thank you. Arigato gozaimasu.
In the middle?
Yes. Oh. So we sandwich you. Thank you.